Thank you for coming at our invitation this morning from the Goa Animal Federation. We are grateful for you to have responded to our invitation at a short notice, and thank you for coming. My esteemed colleagues, friends sitting to my left, Hemaji, who needs no introduction as far as Goa is concerned, Mr. Vijayendra Gairola, and Shri Prakash Kamath, again who needs no introduction. The Goa Animal Federation is an umbrella organization that represents the major animal welfare NGOs in Goa. We have come together so that we are able to make an impact with our unity, and we have been working together over the years. Who are we? We are concerned citizens of Goa, self-motivated, self-financed, non-political. We are working to bring about a harmonious relationship between humankind and animalkind. God has made this world for all creatures, not only for man. So we have to learn to live in harmony with our fellow beings. There is an issue, there is no question about it. The objective of the Goa Animal Federation and the objective of the government is the same. We want to support, complement the government in its efforts, and my colleagues will roll out a humane, legal and practical solution to the dog problem. So we want to advise the government, suggest to the government the way forward, so that we are sure that we achieve the required objectives. That is basically what we are here for. So thank you all so much. We are also happy to hear the statement made by Shri Mohan Bhagwatji that sequestering and the dogs into a shelter is not the answer. The answer is the reduction in their numbers through sterilization and vaccination. So we thank him for putting this whole issue in perspective. And now I would like to request Vijayendra ji to speak a few words and really give you the central theme of today's press conference. Shri Vijayendra.
Thank you, Mr. Rao. Thank you everybody for coming here today. You all would have seen the morning news out of Delhi, and even before that in Goa, because the assembly session has just ended, and a number of our honorable MLAs have raised the issue. And I just have one here from Times of India, 2nd August, where the front page news was ABC program is all bite and no control. ABC program failed to impact dog population. And that came from MLAs across the board. So we do recognize that there is a population issue.
A little louder, please.
Yeah. So we do. Is this better?
Do the volume of voice. Small.
No. Deciding it. Or keep it here.
Okay, so we all recognize there's a problem. What is the problem? The problem is that we have too many community dogs. Call them stray dogs. Government now calls them community dogs as per central government ABC 2023 notification, which is no longer a guideline, it's actually the law. So we need to understand how have we reached here, because unless we understand the problem, define the problem, we will not know what the solution is. We cannot today go to a next solution because the first solution hasn't worked. Let's understand what was the first solution in front of the government, which by the way is the legal solution still across India. As of today, just forget Supreme Court judgment, which by the way was only locational specific to Delhi. It's not valid in Goa, it's not valid in Bombay, it's not valid anywhere else. It's only for Delhi. Okay, so we need to understand that and make it very clear. Goa, by its own stated fact, is still following rest of India in the policy to manage dogs, which is ABC 2023 rules. So that has not changed. The Supreme Court did not say in its order that go and round up dogs in Goa or Bombay. Its order was very locational specific to Delhi, and that too, as all of you know, there's another hearing with a larger bench. So whatever order comes out is a separate issue. But as of today, the only solution which we have is ABC 2023. Now, where have we come from? What is ABC 23? You have to understand there were a number of cases in the Supreme Court, and the most prominent one was a case which was a special leave petition 691 2019, and ultimately as a part of it, Animal Welfare Board of India, and you all know, but just for your information, Animal Welfare Board of India is a part of Animal Husbandry Ministry at center. Okay, so it came out, it gave to Supreme Court a One Health approach, a very comprehensive approach, which had 5 aspects to control dogs population. It gave a lot of data, but basically it recommended 5 things: mass sterilization of dogs, setting up of state infirmaries, setting up of incinerator for animals, because a lot of animals have diseases. In Goa, we don't have an incinerator, by the way. So dogs or any other animal is just dug somewhere in shallow ground, and it has huge health implications for people. The 4th part was 24/7 animal ambulances, and the 5th was to control the illegal breeding. Supreme Court essentially took all of this and told every state to form state monitoring committee for the sterilization. Okay, so you got to understand who's responsible for today's situation. It's important because nobody knows when this news comes out. It has failed. Who has failed? Who's not doing it? Is it NGOs? Is it A department, B department? Who is it? So I want to present certain facts to you so that you understand. And we are not presenting this fact or these facts to pinpoint the blame. We are presenting it so that people understand and we can have a solution. We can fix, hopefully some policy makers would fix the accountability and we'll have a solution under what is available to us today legally. So Supreme Court said, took these 5 suggestions and told every state to form a state monitoring committee. Goa also formed one. And then later on in ABC 2023, these 5 points were included as part of 2023, which I'm sure a lot of you have known. If not, if you Google ABC 2023, you will see all of this. And that's the basic central government document to control and manage the dogs population. So I just wanted to give you background. Okay, so that's the official position. Point number 1. Point number 2. To define the problem, we need to understand what is a dog's population today. Okay, there are different numbers thrown out there. The first time we were doing our research, and the first one we saw was, this is government gathered. By the way, we have a lot of dockets for the press. All of these documents are there, and we are hoping that you can go and do your own research and ask relevant people the questions that we are raising. So this official gazette is dated November 2022, which said, page number 1, the percentage of street dogs to human population in Goa has risen from 3% in 2014 to 9% today. Now, Goa's population is give or take 1.5 crores. 9% of that, 1.4 lakh dogs. This was government's own admission, 1.4 lakh dogs in November 2022. 6 months thereafter, they came up with another notification in which they said, oh, no, sorry, it's not 9%, it's 4.5%. So drastically, 72,000 dogs disappeared in a period of 7 months. We don't know how that happened. And now the government says it's probably something south of that. I don't know what the number is today. But this is where the government for the first time admitted that there are 1.45 lakh dogs 3 years ago. Okay, so that's data point number 2. Now, what do we do? What does the law say? The law says there are various advisories which says the problem, there's AWBI notification here. I'm just going to read it very quickly to you. Just bear with me. And again, all of this is in the docket for you, so you don't have to worry about it. So here, Animal Welfare Board of India says that it is stated that for the effective long-term resolution of conflicts with street animals and prevention of dog bites, it is important that an effective animal birth control program in accordance with law should be in place by local authority. When street dog population is not controlled effectively and scientifically, and dogs are merely relocated or killed, the dog bite cases increase. The dog fights continue overweighting and protection of litters in absence of effective animal birth control rules. Further, it is stated that removing dogs from any area creates an unstable and constant changes which rapidly multiply in the area. Conflict can ultimately and invariably increase in areas where street dogs are dislocated, removed or killed. I'm not saying it from animal welfare, this is government saying it. It's in your docket, you can look at it later. This is government stated position. Okay, so we are not saying anything that government is not saying. Okay, so what happened then? So Supreme Court said form state monitoring committee and do what you're supposed to do, the 5-point program. So we were curious after this news, what's happening? Who's not doing their job? And what is it that we need to do? So we went ahead and put an RTI and took out all the meeting minutes of State Monitoring Committee, which is chaired by Secretary Urban Development. And there are other members, Animal Husbandry in particular is the member secretary of SMC. 2022, January 2022, this is 3.5 years ago. A resolution was passed. Resolution 1, all local bodies to submit their duly constituted ABC monitoring committees within 15 days. 3.5 years ago. Resolution number 2, every local body is required to submit a survey report of the dog numbers to be sterilized in their respective areas. Okay, great. Looks like they have given the right orders. 22nd April 2022, 3 months thereafter, 2 resolutions are passed. Department of Animal Husbandry to fix taluka-wide targets as per street dog population data available and communicate the same to DOP, which is Directorate of Panchayat, and DMA, the municipality. Resolution number 2, and it's very important. DMA DOP shall be responsible to constitute taluka level monitoring committee, which will be headed by the respective block development officer and have the responsibility, representatives from different organizations, and have the responsibility to create the infrastructure for sterilization. 3 years ago. Fast forward today, latest minutes, no such discussion on whether the committees were created, whether the infrastructure was created. The discussion of SMC has now narrowed down to dog registrations. And how do we register dogs? Is that going to solve the problem? Why 3 years ago, when State Monitoring Committee very clearly said that there should be, and Animal Husbandry was told to fix the targets at taluka-wide level. It's been 3 years, nothing has been done. How many dogs do we have? 1.45 lakh dogs. How many are we sterilizing every year? Okay, 1.45 lakh dogs. How many new puppies are born? On an average, we have a lot of animal experts in the room, 10,000, 15,000. Okay, so that's the increase of population. Now we have our member, 4 or 5 major NGOs here. They will tell you that the maximum number of sterilization happening in Goa every year is 15,000. And might I add that this infrastructure is not created by the government. And out of that, WBS, which is doing the maximum sterilization of about 10,000, they are not even taking any money from the government. So we are basically sterilizing today only about 15,000 dogs. So the original population still remains there. Who's going to create the infrastructure? Who's going to, even the committees have not been created. Forget the infrastructure. It's very interesting. I have some more RTIs here that again you will get it. You put an RTI to DOP asking please give us the status details. 13th March 2025 answer came back. The information sought by you does not exist in records of this office. RTI response from DOM, tell us what you have done as part of instructions given by State Monitoring Committee. We have a number of municipalities, I have all the data here. But essentially out of these 13 odd municipalities, there are 2 or 3 municipalities that did about 1,000 odd sterilization over last 3 years in association with some of our NGOs. But again, nothing. Okay. Bottom line is, if we do nothing, nothing is going to happen. Where is the question of failure when we do nothing? Who is responsible for the creation of infrastructure for sterilization today? Is it NGOs? NGOs are running on donations.
Okay, who has not done anything?
Can we take questions later, please? Let's take the question later. So bottom line is, the law clearly states that it is government's responsibility to create local monitoring committees. It's right from the Supreme Court order to the law. And wherever in India it has happened, we have seen brilliant results. In Goa, we don't have luxury to make any statement without the documents backing it. Whatever I have read to you is from the information we have gotten through RTI. 3.5 year State Monitoring Committee has failed to constitute a taluka-wide level committee for even basic census of dogs. Forget the creation. Now, very interestingly, we also asked Animal Husbandry, given the 5-point program of animal welfare, we were also told to, by the way, have animal ambulances. If you recall, I read those 5 things. Okay. So just bear with me, and I will read you their response. Details. We understand it takes time to create infrastructure. So 3.5 years too long. Okay, what about details of 24/7 veterinary care and ambulance service for stray animals in Goa? How many care centers or animal ambulances are operating 24/7 in Goa? Since the announcement was made on 15 December 2023. The answer, currently there are no 24/7 care hospitals or ambulances. This is after government order has come. Details of land and infrastructure provided by the government to DSPCA for establishment of infirmary. Now remember I said that that's one of the 5 points. You have to create infirmary for old dogs, for disabled dogs. In 2020 September they announced they're going to create one. 2025, 5 years later, can you provide us detail? Nil. Okay. So ABC, we have given you the data. 24/7 ambulances, nil. Infirmary, nil. Who's responsible for the current situation today? I think our honorable ministers, honorable chief minister and MLAs need to know. I'm not too sure if they know who's exactly responsible and who's not doing the job. Somebody needs to tell them, and we are here, as Katie said, we are here not, this is not an adversarial press conference. We are here to help the government, to tell them where are the gaps. And in 5 years, if we cannot create one infirmary, we cannot create infrastructure for sterilization, which by the way, if we take earnestly today, we have a plan that one of our colleagues can discuss later. Within 5 years, we can do, not even 5 years, I would say in 3 years, we can have 80 to 90% sterilization achieved in Goa and control the population in less than 100 crores. Now you may say 100 crores is a big number, Do you know what is the cost to create the infrastructure for 1.45 lakh dogs in shelters? It's basic mathematics. Do the mathematics. 40 rupees per day, just the food cost, 200 crores per year. On top of it, salaries and other costs, 5 to 600 crores a year. A dog lives for 10 years, 5,000 crores. I'm not counting right now the cost of creating these 100 odd shelters. You can't manage a shelter of more than 500 dogs. You have to have staff. You're looking at 10,000 crores over next 10 years. Do you know what is budget deficit of Goa today? Projected budget deficit, 3,000 crores. If there's a solution available for 100 crores, which if implemented, which if people are doing their job, we would have never reached this situation. If we have a solution available for 100 crores, why do we want to spend 10,000 crores? Should we not be creating infrastructure for Goans? Should we not be having more hospitals? And if the Animal Husbandry Department, who is the member secretary, if they cannot create an infirmary in 5 years, cannot run ambulances 3 years after the announcement, now they are making a plan to create shelters for 1.25 lakh dogs. Where is the money coming from and how will it be executed? And these are very real questions. So with that, I'm going to pass this over to Mr. Kamath.
Thank you. As already explained by Mr. Vijayan, we are not here to merely criticize. Ours is the initiative of constructive participation and offering our hand to the government to resolve the concern. The issue for us at the moment is, after this Supreme Court judgment, government jumped and formed a task force. No issue, we welcome task force. But what about the statement thereafter, which concerns us all? Because sheltering itself, whether it is legal, that is the first point. Because dogs are territorial. You can't remove one dog from one place and put in another place. They fight, they will destroy themselves, they will destroy the whole environment. In that sense, if you shelter them, we have the biggest first question is that can you shelter this kind of community dogs, bringing them together? One, whether it is legal, whether it is practical, can you do it? As he rightly pointed out, if you have 1.45 lakh dogs around 2 years back, it must be naturally more, because ABC program is not effectively happening in our state. So this kind of numbers, how much money you will need? 10,000 crores. Can you afford to spend it? So what will happen is you will start something non-starter and put it halfway down and mess it up. What will happen is, as it is, dog lovers, NGOs and people who look after these dogs, feed them, they will be also alienated right away the moment you start something like this. So it will be complete chaos. Don't indulge in chaos. That is what we are saying. We are here to offer our help, take our help. And as he said, if you work out ABC effectively over next 8 to 3 years to 5 years, you will spend around 100 crores. Effectively, population of the dogs will be controlled. We will be able to manage things. You have a very effective rabies program. Goa is lauded in the country for 0 rabies cases, at least in Panji, we know that. And other places also government has claimed. So why not build on this kind of initiative we have? So that is what we are saying. So instead of working out something very imaginative, fancy, where 10,000 crore you will never be able to allocate, when your own state deficit of 30,000 crore budget is around 3,000 crore. So what will happen is you will simply disrupt without understanding the issue properly. So we are urging them, don't make headlines by this and forget the next day. We want a constructive solution and we are offering that to you. We are giving that hand, offering that hand, and let us work out something which is practical. and which will give results. And even society will be at peace once they see that this issue of ABC. If ABC guidelines are in place, anything sheltering something can come, it will totally be illegal. It can be easily challenged. So let us understand the concept, let us work on it. So this is what we are here to say. Any questions? Hema, bye. Just make a comment.
Good morning, everybody, and thank you so much. I'm speaking in English, so it reaches all over India. Thank you so much for being here. I am completely with KDG, with Vijendraji and Prakash on this. So I have nothing to say but to support every word they have said. And may the government wake up. Thank you.
What we'd like to do is, I think we know what the problem is. We have tried to pinpoint where the problem is arising from. And again, please understand, it's not to pinpoint blame on anybody, but unless we do that, we can never rectify what needs to be done next. But what is the solution? We asked our member NGOs who collectively do about 12 to 15,000 sterilization every year. They are experts in the field. So we told them, what do we need to do? How do we increase it from 15,000 a year to 50,000 a year so that in 3 years we can control the population? And then, obviously, we have seen a lot of examples, as said in Lucknow and South Bombay is popping free today. A lot of other cities, Jaipur has done phenomenally well by implementing the program honestly, and I wish we had done it 3 years ago, but it's never too late. So we have asked one of our NGOs, and this has come collectively from all of them, to very quickly, briefly tell you what is required to get there in 3 years. So Sejal, if you could come here, just tell what resources are required.
Can I ask something?
Sejal is a true animal lover also.
Can I ask something before you start? Can I ask something or still have something?
Just let her say briefly.
So, what I am going to propose to you today is the actual solution, which is what we want to discuss. And this solution has come from experts in the field. This is not something I am saying or any one NGO is saying. This has been done very successfully. The results are superb, and we have taken from these international NGOs and understood their entire procedure, and if given the opportunity, we will be more than willing to help execute and implement this with the government. Yes? Now, just to give you an example, in Uttarakhand, Dehradun, Mussoorie and Nainital, 90% sterilization and vaccination rates have been achieved. In Dehradun, 40% of the population has dropped since 2016 of dogs. Complaints have fallen by 30% and community engagement has increased by 30%. This job is not only the government or only the NGO or only the citizens, it is all of us collectively doing it together, because we all have to take responsibility. In Lucknow, 83% coverage. They have done sterilized 90,000 dogs from just one center within 6 years. In Baroda, Gujarat, 86%. So, this has been done. We in Goa want to do this because this is the correct way. Now, let us start about Goa. Let us assume, like Vijendraji sir said, there's 1,50,000 dogs. If we have to sterilize 1,50,000 dogs, we have to do it within a period of 2 to 3 years. A sterilization project cannot exceed that period too much. We have to go faster than the multiplication rate. So in Goa, if 2 centers were set up and there was 1,50,000 dogs, just hypothetically we assume every day 164 surgeries need to be done between 2 centers, which means each center has to do 80 to 85 surgeries per day. And this is doable. Each center requires basically 4 vets. I'll give you the, in terms of staffing, for example, we would need 4 veterinarians, 10 para-veterinarians, 30 trained dog catchers, 5 handlers, cleaners, 2 administrative. We would need 8 vehicles, we would need 8 drivers. And with this, with 2 big centers where we can accommodate 300 to 400 dogs per center, we can easily do this in 3 years. Okay? What we require support with is the infrastructure. We don't have the land as private NGOs. We need 2 acres in north, 2 acres in south. They need to set up a basic infrastructure with the kennels and the operation theatre. Give us the veterinarians. The government has so many veterinarians. And we NGOs will bring our expertise of how to catch. We have international NGOs sitting in Goa who do phenomenal work. They know how to trap. They have great training programs in Goa for surgeries. We are happy to train the vets. We are happy to help with the management. We are very happy to support the government. But this is very doable. It is not rocket science. It is just political will, and we can do it. You know. So yeah, this is the plan. Thank you. Thank you.
Sure, we can take questions now. Sir, you wanted to ask?
So you all are saying that the government has failed in controlling
The data
population of the dog.
data is showing.
No, but
We are doing again. We are not making any statement without backing it up. I showed you government's own gazette, which showed a population of 1.45 lakh dogs, which by the way itself said the program has failed. Okay, the MNCs are saying program has failed. I'm not saying.
So right now the government has tied up with how many NGOs with this ABC?
See, the government has tied up. There are only 4 or 5 NGOs. Please understand one thing: NGOs have their capacity limitations. Who is supposed to create the infrastructure for sterilization? We are asking the government to create the infrastructure and hand it over to NGOs to run it. Right now, the limited infrastructure for sterilization has been created by NGOs themselves that run on donations. How much can they do? We need a capacity of 50,000 sterilizations every year. We have a capacity of 15,000. So we are requesting the government to increase the infrastructure, bring in NGOs to run it, do more sterilizations. That requires funds. Yes, it requires funds. Yes, it's a 100 crore rupee solution, but it is cheaper than a 10,000 rupee crore solution. Do we have any other solution right now? Is there any other legal solution on the table? If one has, please tell us.
no, but I fail to understand one thing.
I'll just add that around 190 panchayats
Yeah,
are there. How many
solution
panchayats are effectively doing
You all are talking about everything.
Yeah.
You spoke about an RTI about DOP, right? Any information that you have as far as animal husbandry, or that you have written to the Ministry of Animal Husbandry, like the Minister Nilkan Helankar. Why I am asking is that every year, what I remember, they had this sterilization program. They had a press conference. They informed about the doctor, and I don't get his name, rabies sterilization. They always talk about that, and they have even said what would be the funding of that project. I don't know if I'm correct, 4 crores, 5 crores. Do you have any statistics of this every year, what they do that?
For rabies program, are you talking about?
Rabies program, sterilization program, which the minister always talks. And I hope you also know that he has been talking on that. हमें करता है सगलवत करता
देखिए तो बोलना एक चीज है
सो अगर नहीं किया है तो क्या नहीं किया है तुम बोलो ना
तो मैं आपको डॉक्यूमेंट दिखाता हूँ
डॉक्यूमेंट में आपने
ये डॉक्यूमेंट एनिमल हस्बेंड्री से आया है
सो एनिमल हस्बेंड्री ने कितना पैसा खर्च किया है अगर नहीं किया है तो इन 3.5 सालों में जो मिनिस्टर है उसने कुछ नहीं किया है वो आप हमें बताइए ना See, the issue, why I'm saying the issue at the moment is what? Rabies issue. See, there have been let me see. 1 or 2 incidents have taken place. Dog bites issue is there. And in number of dogs incidents. So these are the 3 issues. Correct. Though the main 2 issues are dog bites, because almost 4-5 cases, foreigners or tourists, then number of increased dogs. All these issues are there, and time and again the minister Like the recent assembly session, whenever we have asked him, he has been saying again and again, हमें सवाल क्या हमने सब कुछ किया है, अगर नहीं किया है तो आपके पास क्या है वो जो उसने कुछ नहीं किया है करके. आप DOP का बता रहे हैं, वो तो अलग है.
No,
but the finally it has to come from the ministry, you know.
I have understood your question. We'll leave a docket for you, okay? Understand who's supposed to execute this.
You tell us.
Local monitoring body, it's in SMC minutes. Not animal husbandry. Local monitoring bodies needs to be constituted at panchayat level to do the at taluka wide level to do the dog census, to create the infrastructure for sterilization. That hasn't happened. Your points are very valid. When there are more dogs, there are going to be more incidents. So we are not defending here that there are more dog bites or less dog bites. It's there, but it's a symptom of more population of dogs. What has been done, animal husbandry does give money to existing NGOs. What we are saying is the infrastructure which is on the ground today is for 15,000 dogs, which is not even the new dogs which are coming in through new birth. We need to create an infrastructure for not 15, but for 50,000 dogs, and that is government's responsibility. Now the rules say that that responsibility falls with the local bodies, which is the panchayat.
Now here the problem lies when you are saying the
Correct.
local bodies.
And
the local bodies doesn't have the funds. Okay.
This fund has to come from where?
I will speak about garbage. I will speak about the stray cattle. Now the stray dogs. So when they don't have the funds, how they are going to tackle with this?
Okay, do you have any statistics? How much the animal husbandry department or ministry spends on this?
On sterilization?
On sterilization and everything?
We can get you that statistics. I don't have it.
You should have had it.
But I will get you that number. The question is not how much, whatever they are spending is not enough because sterilization is happening.
That's what I'm saying. See, if that fund is not enough, then how much, and at least have you all found out whether that money has reached even to the panchayats?
This is between two different government departments. We would request you as media, you should be asking these questions to panchayat. And
you have found out RTI, no?
We did not put an RTI for internal funding between...
No, finally, you have found out, you have made up an RTI to DOP. How the director of panchayat will give you?
Let me reiterate. SMC meeting minutes, which I made mention of, said that taluka-wide level committees need to be made as first step to do the dog census. That first step was never taken to make that call. So if you don't do that, the second step is creation of infrastructure. Okay. So this is the state monitoring committee which has to hold people accountable to make the committees and create the infrastructure. You are asking the question about how the funds are moving between one government department to another. I think it's the respective departments that can answer better. What I'm telling you is that in as much as we don't know how the funds are moving between different departments, we are saying overall the result is not there because there is no capacity to do the sterilization.
Committees also not in place doing.
Having committees doesn't help because until and unless they have the funds, because funds are not given to the we are attending many Gram Sabhas and I have not seen funds given for animal birth control.
So I have attended press conferences of the minister as far as mission rabies is concerned, mission sterilization. I don't know, even some of them might be there. These are the things what the minister has said, not the panchayat has said. When you have a press conference, when you talk about this, when you are funding, you are talking about funding and everything, minister gives a press conference. And on top of that, you will think the panchayat will answer. It is the minister who has to answer, no? Or the department, no? So if the department has certain things, whether they have done. You spoke about 5 years. Now, almost, you just take 3.5 years of this. The concerned animal husbandry or something. What has been done? I'm facing the issues of good dogs. I'm facing the issue of dogs in my place here. Early morning, there are around 25 to 30 stray dogs which come close to our house and all. It is a dangerous situation. Now, whom to blame? Would you blame the panchayat? Because you talk about sterilization. Panchayat will do the sterilization, or the concerned department who will order to do all these things. Like the municipality does, if you remember.
Can they listen? Just now I said that you make a task force. Correct? Now listen to me.
सगळे तू पेपराचेर सांगलेल्या भशेन सगळे सांगता रियलिटीन he is saying रियलिटीन जावंकूच ना न्हू तें 3.5 वर्सां. You all have come now. Why? Because the issue has come.
Can they listen? Listen, no, at least. What I am saying is, you have announced task force. Tomorrow, supposing you start sheltering, but you don't have committees in place, you don't have fund allocation, how that will happen? That is what has happened here, that is what we are saying. You have made statements, minister makes statements, policy statements are made about various things, about ABC and all. But as he says, there has to be a system in place. What is the system? System is monitoring committees. If you don't form them, if you through them don't work out the population, if you don't do the survey of population, if you don't reach out to panchayat, then with so much of number, then the funding, how it will implement? That is what we are asking. So we are asking there should be system.
So are you going to sit with the minister regarding it? It is better to sit with the minister.
Why not?
Can I answer this?
You are ready.
Yeah, sorry.
Yeah.
Thanks. I hold the government responsible for this.
That has to be there. You are not trying to say that.
No, he has said this in the very beginning also.
No. See, ma'am, the thing is that.
Let me take the sole responsibility on this, please. I take sole responsibility to say this on this. The government decides what the monitoring body does also, as put them in responsibility. Who is presiding all over everything in Goa today? It's the government. So everything that happens here, the government is responsible.
Just tell me.
Why it took 3.5
Correct.
years to come and complain about
Yeah.
it? Why didn't you write a letter? Why didn't you file an RTF before? Why it took you 3.5 years to complain and allege against the government? So this has been popping persistently.
For a long time.
Can I also answer this? Sorry?
Excuse
me, 1 minute.
Yeah.
The selfless people are sitting here. We are not being paid by anybody to do this, please. We cannot answer question, why didn't we do something? We
Hello?
are sitting here means we are doing something. That's it.
Maybe
That means we care.
Maybe take your help. Can I put that question back to the press? Why didn't you ask that question to the government?
We have been asking the minister.
They've been
And what
asking
is
forever.
what is the answer?
We are doing our job.
We are doing our work.
So we are leaving all the
They are saying
documents
that
with
we are
you.
Since you are an
No. I will make a simple list. Forget whatever has happened. Now all these people, we have come together. We have formed a federation. There is no need for government to go to
Selflessly.
X, Y, Z. You call us. Yes, we are all ready to help. We have said it. We are not just criticizing. We are just ready to do constructive work.
No, Prakash,
So
why are you waiting for
call
the
the-
government to call you? Why you can't call on the
We have been doing it, excuse me, sorry. You've seen what I have been doing. I have gone from the collector's office to the headquarters of the police to the municipality. I have been continuously, I was supposed to have this press meet, but when these very selfless, great people are sitting who care for the dog, for humans first. Why do we care for the dogs? It's the human, we care about humans and everything has to go good for humans. So you care about dogs. That's part of the duty of a human to take care of a dog. When is the government going to do its duty and complete that? Everything from my side, solely here speaking for myself, is the government is responsible for everything to be done, including in Delhi.
No, why I have asked you, like she said, I have asked the minister a number of times, what you have done. Sterilization, कितले पैसे मोडटले, पैसे मोडले जाल्यार ते कशे मोडले, खंय गेले ते. So all these things, that's why I know about these things. I might be wrong in the total number of amount project funded. So if so much money is spent in the last 3 years, every year they do that. So where the money has gone? Like the documents which you have provided, it might be not from the animal husbandry, but money has been spent.
Where's
So-
the money gone? Is something he will not answer.
So you should tell us, no, that.
We don't know.
Yes.
We have
Very
put
good.
before
You're
the
asking
media.
us-
So
No, see, listen, you have come with the documents. If I was asking a wrong person, then you should have not given me some statistics. You have given me some statistics. So on that basis of that statistics, I have asked you, I have given you extra information.
I think he misunderstood you, maybe. I think so. Let me quickly tell you something. I was the trustee for Posh Shelter. At a certain time when people like Sanjeet Rodrigues was in the top position in the municipality, at a certain time when Angela Dicuna, Dr. Virupasha Banakar were looking after things in Panjim, rabies had gone down completely, vaccination was superb, sterilization was absolutely. What is happening now? Why are they being transferred, the good people? What? Why suddenly when great work is happening, why things like this are happening? I'm asking the government. Hema is always questioning. And I'm asking today because I'm standing here solely, this is me speaking, okay? I'm not speaking for anybody. I'm standing by what they said though. Completely and 100% standing by every word that was spoken here, even by Sejal.
I think you asked very fair questions. Dog bites, the fear, it's real. We're not discounting it. Dog bites happening, we don't know what the exact data is. Probably happening. When was the last time you heard a dog bite from Panjim area? Most of it are from, we are hearing of Lake Ponda, we are hearing coastal belt, which is basically the tourism area, but not Panjim area. Very few. Very few. There's a reason for that. There are three things happening here. PAWS is doing fantastic work in terms of sterilizing as many dogs as possible. Second, there's a very strong feeder network, which by the way, as per Rule 20 of ABC, is supposed to feed to keep their food aggression down. So there's a very good feeder network in entire North Goa. There's good amount of sterilization happening in around Panjim area because of CCP and North because of WBS. So you see those and because of better education and advocacy, people are not aggressive towards dogs. So you see lesser amount of dog bites.
Okay.
This is what we need to replicate here. Now let me take the Ponda case since you mentioned it. DSPC has been investigating it. SDM gave an order to demarcate the feeding location in Ponda. The team reached there along with a cop. The locals came out threatening the feeder, outraging her modesty, for which she has lodged a police complaint. So if we do not keep dogs hungry, you are aggressive towards them. What do you expect in return? We have to increase the sterilization, we have to feed them, and we have to have a community outreach. There's a good amount of people in Goa. As we said, the fear, we are not disparaging your fear. Some people have fear, but it can be overcome by right amount of education that number of NGOs can provide. So we have to find a solution within the ambit of what is available to us today. We are working within the framework, legal framework of what is available to us. If there's another legal framework tomorrow, we will discuss it there.
आता म्हाका सांगा तुम्ही सांगले की 100 कोटी लागतले म्हणून सांगले सगळे करपा खातीर अजूनपर्यंत सरकारान कितले पैसे मोडले जर वेस्ट जाल्यार सरकारान कितले पैसे वेस्ट केला डेटा तुमच्याकडे अमाउंट कितली ती
We will make a study on this. I quickly want to tell the people of Goa that please don't think the people who are sitting here are not worried about the bites, not worried about we are very, very worried. Let me tell you, there are things that in school have to be taught. Don't run away. Please hear this, everybody. Don't run away when a dog is approaching you because he's thinking you're robbing something from his locality, which he is protecting. The dog has no control and choice. The dog is just doing what he thinks is right. He was not given that intelligence to think otherwise. Also, when the dog bites, it could be because of aggression by humans. It's a defense thing. Think about all this. Where are humans going wrong before we blame the dog? Thank you very much. I have to leave. I have to go for another session. God bless you all.